Good afternoon. Welcome to NSC 303 Community and Public Health Nursing 1. I'm Tayo Ezekiel. Welcome to class. Community and public health nursing is defined as the practice of promoting and protecting the health populations using knowledge from nursing, social, and public health sciences. So, community and public health nurses, they assess individuals and families in their community to provide basic health care for them. The history of community and public health nursing practice. In the year 1909, Lillian Wald established the first community health nursing program for workers at the Metropolitan Life Insurance Company in the United States. So she believed that keeping workers healthier meant their productivity would increase. So she urged that nurses at agencies provide skilled nursing care to ensure healthier workers. That was how community and public health nursing practice began. Okay, so this chart is showing us, summarizing the roles of community and public health nurses in diverse community settings. They could act as managers, they educate the community members, they provide care to the community members, and so on and so forth. So the context of family as a unit of care in the community. A community and public health nurse provides health care for the community at large. And in the community, the family is a core aspect, the integral aspect of the community. So the family is a group of individuals related by blood, marriage, or by choice who live together. And basically, we have two types of family: the nuclear families, including the parents and the children, and the extended family, where we have the grandparents, aunts, uncles, and the like. So the family, as I said earlier, is an integral part of community health nursing program. So the family developmental task. In community health nursing practice, family is considered as a unit of service. Why? Because of these following highlighted reasons. The family is a natural and fundamental unit of the society. The family as a group, it generates, prevents, tolerates, and corrects health problems within its membership. Then the health problems of family are interlocking, or we can say they are genetical. So there's a history already, the family already knows there's a history about a particular health problem in the family. The family also provides crucial environmental force for each member of the family because they constantly interact and they know where they are coming from. Then it is the most frequent locus of healthcare provision, even to access, for an individual to access personal care. All right. Then the family nursing theories, there are basic theories that explains the family nursing theories. So they are highlighted for us here. We have, and all, it's important to know that all these theories explains nursing care. It describes nursing care. It predicts nursing care. It prescribes nursing care. And these are some of the theories being highlighted here. We have the Florence Nightingale theory of environment. We have the Matarogas science of unitar human being. There's a Block and Justice ethical theory population focused nursing. The Knowledge Pendants health promotion model is also there, and so on and so forth. Then the tools in family health assessment and family care. There are three basic tools that can be used to ask for family assessment health, for the family health assessment. The genograms are there. These are visual representations of family relationships and health histories. Then we have the echo maps. This is a diagram showing family interaction with the external environment. And we have the health interviews. These are conversations you have with family. You inquire about their health practices, their beliefs, their cultural beliefs, and their concerns. Then we have community assessment. This is a process of searching for and validating relevant community-based data according to specified methods. So it's important that the public health, community and public health nurse do community assessment. You must validate the information you have. And these are the basic aspects of community assessment. You have the physical environment, you have the health and social system, the economics, safety and transportation, politics and government, communication, education, and recreation. These are a few among many other things that needs to be probed into. That the public health nurse must get information and validate in the family. Okay, so the community health nursing process provides, it's a process. Community health, public health nursing is a process. And what do they do basically? Assessment. As I explained earlier, there must be assessment where you validate the information you have. You must plan. For example, if you have done the assessment and probably you discover there's a particular genetic, let's take sickle cell disease for example. You have assessed, you have gotten information about a particular family, there must be planning. Okay, what do you want to do to help this particular family to intervene? Then the intervention begins. Intervention now includes probably giving health education, advising the family on, oh, please, this sickle cell disease is a result of this. Please, this is the caution you need to take. You need to know this, you need to know that. That's an intervention. Then later, after the intervention programs, you come back to evaluate. Okay, are they yielding to what they have learned? So what is happening now? What is the current state of things happening in this family? Then we have the prevention of illness or diseases. These are usually in levels. Disease prevention is in levels. We have the primordial level, which the objective is to prevent the onset of illness. The primary level is to prevent the onset of specific diseases. The secondary level is to discover for early diagnosis and treatment or to prevent further damage to an individual. Then we have the tertiary level to prevent damage, further damage that will be arising from a particular disease. Then we have the demography and population dynamics. It is important. Don't forget, as a public and community health nurse, when you are validating information, you must know the social demographic variables of the people you are working with. The first stage of assessing a community is to know about its people. You cannot assess a community without knowing about them. So you have to know their history, you have to know their demography, including their age, sex, ethnicity, their marital status, then vital statistics, the mortality rate, the natality rate, then their values, their belief system, their religious practices must be known. Then in conclusion, the practice of public nursing practice is a specialty that is population focused. It focuses on the people of the community. And remember that we said that the family is an integral part, the core part of the community. Thank you very much. I believe you enjoyed the class. You enjoyed the class. So please, I would love to welcome your concerns, your questions, whatsoever thing you want to say about today's class. You can drop it on your portal, you can drop it in the chat box, you can send an email to me, and you can be sure, I can guarantee you, that you have a response as soon as I get those concerns and questions. Thank you very much and have a great day. Bye for now. See you in the next class. Thank you.